Morning, guys. It's February 1st. This is the second portion of the female reproductive system. We're going to briefly go through around 25 slides, kind of break this up into three different parts. We left off with, I believe, on slide 20, discussing the uterus. The uterus is going to be an important structure, specifically the three different layers. That's going to be probably the most testable material. Essentially, the uterus is going to consist of different portions: the fundus, the body, the isthmus, and then the cervix. Again, we discussed in lecture that the cervix was the opening into the vagina. The normal position of the uterus is an anteflexion. This means it's just in anterior and superior over the bladder. I do want you to know the three layers of the uterus, being the perimetrium, the myometrium, and then the endometrium. Again, if you just know the prefixes, you guys should be in good shape. The perimetrium is the outer layer. Peri means around. This is part of the visceral peritoneum. You guys remember yesterday we talked about the broad ligament, how it was part of the parietal peritoneum. This is part of the visceral peritoneum. Now, as we go from superficial to deep, we'll begin talking about the myometrium. The myometrium is just going to be a layer of smooth muscle. Again, myo meaning muscle, so the muscular layer. This is going to, this layer right here is going to contract during birth in response to oxytocin from the posterior pituitary. And again, if you guys remember the two hormones present in the posterior pituitary, oxytocin, absolutely, and then antidiuretic hormone. Good. The endometrium is going to be the inner layer. This is going to be a highly vascularized area, a lot of blood vessels coming through here. You have the stratum functionalis and the stratum bassalis. Both of those are important to know. The stratum functionalis, again, this is going to be the layer that actually sheds during menstruation. The stratum bassalis is a more permanent layer that gives rise to a new stratum functionalis after each menstruation. So again, going back onto the uterus, again, the uterus is going to have an opening called the cervix, which opens into the vagina. Again, you know the uterus has the uterine tubes or the fallopian tubes, which are going to be the, it's essentially going to coordinate the egg traveling from the ovary into the uterus. As this sperm penetrate the vagina, it will then go into the cervix, and from the cervix it will pass into the uterus, into the fallopian tubes, where it will then come in contact with the egg. From there, it will implant into the uterus, and from there you will have continued development. So the blood supply is going to come from some different arteries. Again, you don't have to know all of these, but you have the uterine artery, you have something called the arcuate artery, and the radial arteries. Essentially, these all branch off of each other, and as they penetrate the endometrium, they divide in something called the straight arterioles. The straight arterioles, and again, arterioles are just smaller arteries. These are what's going to supply the stratum bassalis. And again, if you guys remember, the stratum bassalis is just this permanent layer that gives rise to the stratum functionalis as the stratum functionalis sloughs off during each menstrual cycle. The spiral arteries supply the stratum functionalis. And again, these will change markedly during the menstrual cycle. What's important to know is this cervical mucus. This is the more important thing on the slide. The cervical mucus is secreted by the secretory cells of the cervix mucosa. What does the cervical mucus do? A bunch of different things. It is going to be responsible for protecting sperm from phagocytes. It's also going to be responsible for supplementing energy that is needed for the sperm, and it's going to consist of different things like water, glycoproteins, lipids, enzymes, and inorganic salts. So I think probably the most important thing to know on this slide is the cervical mucus is secreted by the secretory cells of the mucosa of the cervix. Also important to know is that it supplements energy needs of the sperm and it protects the sperm from phagocytes. Here's a picture here showing you the lumen of the uterus on a transverse section. You'll see here this is the stratum basalis. This is the basal layer, which is closer to the basement membrane. You'll have the stratum functionalis. Again, this is going to be the layer that sloughs off during menstruation. Within the myometrium, you've got longitudinal smooth muscle. Then you've got middle circular muscle. Again, the myometrium is going to be the layer that's responsible for contraction in response to oxytocin. Then you have the perimetrium, which is the outer layer. So the perimetrium, then you've got the myometrium in here, and then you've got the endometrium, which is the inner layer. The endometrium is going to be the layer that actually sloughs off. You can see here one of the cervical mucosal glands. It's this long columnar shape right here. This is the stratum basalis. This is going to be the more permanent layer. This is the stratum functionalis, the more outer layer. This is going to just show you blood supply here. This is the uterine artery as it will branch off into the arcuate arteries. Then you'll get branched off into the straight arterioles and then the spiral arteries as they penetrate the stratum functionalis. Here is another picture of the uterus. There's the ovary sitting up here in relation to the fallopian tube. This is the fimbriae of the uterine tube. Can you remember previously we talked about how the secondary oocyte would travel through the fallopian tube into the ampulla where the sperm would then meet it um, um, for fertilization. This is the round ligament of the uterus. Again, this is going to be the ligament that actually contains the uterine artery as it's going to supply here before it divides into the arcuate artery. The broad ligament is just going to be part of the parietal peritoneum. This is the cervix. This is the area where there is actually, they take a sample from the internal and external os, something called the transitional zone, and this is where they will detect cancer cells. This is the cervix. Again, this is the opening. This is exactly where they will do the cervical smear for HPV analysis or atypical cells. So let's begin talking about pathology of the cervix. This is HPV here. This is under a certain type of, I think this might be Wood's light, in order to depict something called chluocytes. They'll talk about chluocytic changes. HPV is just a virus. It's a virus that it infects the cells and can cause cancer. There's some tumor markers, some tumor suppressor genes, P53 and retinoblastoma, P53 and RB. This might be a little bit beyond our scope, but HPV produces proteins, E6 and E7, which are going to be responsible for inhibiting these tumor suppressor genes. Anytime you inhibit a tumor suppressor gene, what happens? We have an increase in cancer cell growth. HPV can just cause genital warts. That is going to be the more benign form. Again, that's not cancerous, or it can cause cancer or carcinoma. And that's going to be obviously the more worrisome thing that happens. This is squamous cell carcinoma. As you can see here, it's very vascularized. It looks like it's been bleeding. It's often called a friable appearance. You can see here it kind of looks fried. This is also caused by HPV, caused by other things too. Like smoking, alcohol use is associated with increased risk of squamous cell carcinoma. Let's begin talking about the vagina. The vagina is going to be a fibromuscular canal extending from the exterior of the body to the uterine cervix. Again, we know this. Again, this is going to be the entry of where sperm enters in. The sperm will enter in through the vagina, into the cervix, into the uterus, through the fallopian tubes, and then will meet the egg for fertilization. Again, alkaline components of the semen raise the pH. Normally, the vagina has a more acidic environment. I believe it was Jared who told us, either Jared or Cody was talking about the acidic nature of the vagina. The sperm, if you remember, it's a little bit more alkaline. It's more alkaline or a higher pH in order to survive within the vaginal canal itself. There are different layers: the muscularis, the adventitia, and the hymen. The hymen forms a border around and partially closes the vaginal orifice. Prior to intercourse, a lot of times the hymen will actually still be intact. Otherwise, it's very difficult to visualize. The muscularis is going to be the two layers of the smooth muscle. And then there's something called the adventitia. This actually anchors the vagina to adjacent organs. Now we'll begin talking about the vulva. Again, we talked about the vulva in regards to at the beginning of yesterday's lecture. The vulva is actually visible. The uterus is not visible. The cervix is not visible unless you have special tools in a gynecology or in a gynecology exam room. The mons pubis, this is going to be the area that cushions the pubic symphysis. You've got the labia majora and the labia minora. These are homologous or similar to the scrotum for the females. The labia minora is actually similar to the penile urethra. Again, I know it's hard to imagine this. These structures will actually form depending on whether testosterone or estrogen is present during genital development inside the womb. So whether there's the presence of a Y chromosome or an X chromosome will depend on whether these these structures form or not. The vestibule, this is the region between the labia minora. It actually houses the external urethral orifice and is the opening of several ducted glands, one called the Bartholin glands. These are located at I believe it's the 5 and 7 o'clock position inside the vestibule. And then you've got the vaginal orifice. The bulb of the vestibule, these are two elongated masses of erectile tissue on either side of the vaginal orifice. These are responsible for engorging with blood during arousal and placing pressure on the penis during intercourse. Here's a picture here. This is the mons pubis. This is just going to cushion the pubic symphysis. This is the labia minora. This is going to be the smaller area, and the labia majora, which is going to be the larger area here as well. This is the prepuce of the clitoris. This area is going to be highly innervated with nerve supply and going to be very sensitive. This is the hymen. The hymen, again, is often intact prior to intercourse. Again, the anus and its relationship. It's important to know, as we'll begin to discuss later on, that the women have a shorter relationship from the anus to the urethra because of this shorter urethra. Because it's closer position, they're going to be more prone to UTIs than males. As you can see, males have a much different their urethra is going to be in different relationship to the anus. Therefore, it's going to be you're less likely to get UTIs. Again, this is the vaginal orifice and the external urethral orifice as well. The perineum, this is going to be just a diamond-shaped area medial to the thighs and buttocks. Here it's visualized. As you can see, the dissections taken here. This would be the external female genitalia. This is going to be the perineum. Gluteus maximus muscles right in here. This is the coccyx, which is the end of the sacrum. This is something called the anal triangle. Here you'll have a muscle called the ischiocavernosus muscle, and you'll have the bulbospongiosus muscle. This is an area called the urogenital triangle. Essentially, I just want you to know the perineum contains the external genitalia and the anus. This is something I've been talking about this entire time. This is called a pap smear. This is used for cervical cancer screening. We talked about the gynecology exam, how they would take a speculum and they would insert it, and this would help in order to take a brush. And as you can see here, they're going through the vagina into the cervix, which is the opening to the uterus. The cervix, again, being this opening, there's going to be an area called the internal os, which is going to be more internal to the uterus, and there's going to be an area called the external os. The external os is closer to the vagina. In between the internal and external os is going to be an area called the transitional zone. And it's really in this area here where cancer likes to occur, between the transition of the different epithelium. This is where HPV likes to infect. Because of this transitional zone, we're going to get in here and take samples, and from there we'll send the samples to the pathologist in order for him to look at these. So we remove cells from the cervix and we look at them. This is a normal class 1 cervical slide here. You can see the purple showing the nuclei, which are present here. This is a class 4, as you can see. This is more darkly stained purple. There's an increase in mitotic activity here. This is letting you know, because there's an increase in the level of mitosis, that cancer is occurring here. As you can see here, this purple is representing the nuclei that is present. There's not much mitotic activity happening here. Probably just a normal amount. Again, I'm not a pathologist, but as you can see here, it doesn't take a pathologist to realize that this is abnormal. If this is normal, this is your normal looking cells that are present. You can see that this is classically not normal right here. This increase in purple is going to be an increase in nuclei. This purple is representing the nuclei that's present here. If there's more nuclei, that means there's more what? There's more cell division. What is the definition of cancer? Unregulated cell division, and that's what exactly is happening here. We'll now begin talking about the breast and mammary glands. We'll talk about 3 different things: the nipple, the areola, and the mammary gland. The nipple is going to be the opening of the lactiferous ducts. The lactiferous ducts are going to be the ducts in which milk is ejected from. You're going to have the areola. Again, this is just the pigmented area that contains oil and glands. The mammary gland itself is going to be what's responsible for lactation. Do you guys remember the hormone and where it comes from, which is responsible for causing the mammary glands to lactate? Again, that's prolactin. Do you guys remember where it's secreted from? That's right, it's the anterior pituitary. Good. So prolactin comes down from the anterior pituitary, and it causes the mammary glands to lactate. The mammary glands are going to be a modified sudoriferous gland that produces milk, right? Milk secreting glands. So lactation, this is a process that includes synthesis, secretion, and injection of milk. Here's just going to be an area. As you can see here, you're going to have the pectoral. So let's go from deep to superficial. So you've got the rib, right? The rib is going to have fascia. Again, remember, fascia is just this enclosed type of material that encloses muscle. That helps with movement. This is something called the intercostal muscles. Inter meaning between, costal in between the cartilage of the ribs. So this is just muscle in between the ribs. So as you get more anterior, you're going to see here something called the pectoralis major muscles. This is just your chest muscle, right? This is what's responsible for bench pressing. As you get more anterior here, you're going to start getting into some fat. Again, the breast is largely made up of fat. You'll see once we get into the actual duct system itself, you'll see these lobules. These lobules containing alveoli present within here. This is called the mammary duct, right? We've got the mammary glands. This is the lactiferous duct. The lactiferous duct is what actually opens up into the nipple itself. There are cancer that involves the lactiferous ducts. As you get further on into professional school, if you guys choose to go, you guys will learn about this in a pathology lecture. This is the areola. This is just the pigmented skin that outlines the nipple. Again, the nipple is the opening to the lactiferous duct. Here is a different view, again, just showing you the nipple itself, again, opening into the lactiferous duct. The areola is just a pigmented area. You can see here the lactiferous sinuses and the lactiferous ducts. These ducts can become clogged. Oftentimes they get clogged during breastfeeding, and you'll may have some sensitivity and pain. Usually you just do some warm compresses and continue breastfeeding, and they'll unclog themselves. So this is just breast cancer screening. This is something called a mammography, in which they take a visual image. We'll show you on this next slide here. This is just showing you, again, the cross-section of the lactiferous duct here, showing you some lymph nodes present as well. Breast cancer. What are symptoms of breast cancer? This includes a lump in the breast, bloody discharge from the nipple, changes in the shape or texture of the nipple or breast. Women should undergo routine mammography beginning at the age of 40. This has been a new change as of late. This is a self-examination of the breast. manual inspection, so you should be reclined usually. This takes any type of variation out of the exam. So with the fingertips closed together, gently probe each breast in one of these areas. So it's important not to lift your fingers up as you can miss lumps. So again, all of these symptoms are concerning and should prompt you to visit your physician. So a lump in the breast, bloody discharge from the nipple, or changes in the shape or texture of the breasts themselves. Um, let's see, how many more slides? I believe this is a good place to stop. Let's stop at breast cancer, and then I will give a third portion of the lecture preview tomorrow. Again, some important things: know the warning signs of breast cancer. Um, um, Again, this is just good to know that mammography is an MRI showing you the visualizations of the lymph nodes and the duct systems themselves. Um, be familiar with anatomy. Know the areas of the breast themselves. Um, yeah, so if you guys have any questions, please feel free to reach out to me. Again, as always, it's a pleasure to get to do these lectures for you guys. I hope they help.